Thanks for the opportunity by Krishna Kumar and his team for inviting me and giving me a very interesting topic, a topic which is very dear to my heart, and I don't get tired of talking it year after year, month after month. So quickly, what I thought was I will talk about improving profitability through technology in healthcare. I think considering the situation that is prevailing in the country today, I should not talk about improving profitability. I think I should talk about making hospitals more cost effective. Okay, I think that would be a better way of putting the topic. I think this is again a very interesting quote which I always use in my presentations by Narasimha Rao. And he said if we had fought the British with cannons instead of swords, I think our destinies would have been different. I believe that technology is a great leveler. Technology is a great enabler. I think we should go one step further, as somebody pointed out today. It is just not an enabler today. It is a tool for social transformation, actually. And I just remember when Mr. Chandrasekhar, who is the MD of TCS, he once said in an interview that maybe about 10 years ago, technology was in business. You know, if you do banking, if you do healthcare, if you do retail, technology will be in business. But today, business is in technology. You know, you have technology and you have to run your, whether it is healthcare, you have to put healthcare into technology. You have to put retail in technology. I think that is the way we are looking at. And secondly, in those days, somebody was saying, how many are computer literate in our hospital? Do they have computer knowledge and all that? And we are trying to learn computer. But now, I think, you know, we are not learning computer. Our computer is learning us, actually. So they can do much better than what human beings can do. So now the topic today is how to improve hospital profitability. Let us say we have to improve the profitability EBITDA from 15% to 20%. What we should need to do, what we need to do in the hospital. There are three things which we need to do. We need to do three things. One is contain project cost. You know, can you believe today, maybe I must confess that I am doing a hospital where the cost of per bed can be more than 1 crore of rupees, I have also done hospitals which cost about 50 lakhs and 20 lakhs and 30 lakhs of rupees. But you may ask me, how does it affect the profitability? But I take loan, I take public equity, then the interest cost goes up. So the cost is now pushed on to the patient again. So when you plan a project, when you implement a project, you need to be careful so that you contain the cost. And then reduce costs of the hospital operations. When the hospitals are operating, I think you must reduce the cost, maybe material cost, the manpower cost, electricity cost, all that cost you reduce when there is when the hospital is in operation. And another way of improving the profitability is to increase the revenue of the hospital. If you are maybe treating 500 patients a day, can I treat 800 patients a day? How do I increase the revenue? These are all the ways you can increase the profitability of the hospital. But if you have to increase the profitability of the hospital, I think Neelakandan raised a very, very appropriate point. I think he hit the nail on the head. Just imagine if you have a nursing staff who is paid 15,000, her salary has to be doubled, and we are talking about a nursing strength of about 500 nurses in the hospital. God only should help that hospital. But I have a solution. Neelakandan, come to me. I have a solution. I have a solution. Solution is all about technology. Please understand, I think we have not understood what technology can do for us. I'm going to quickly run through some of the very, very disruptive technologies that have taken place in healthcare. And honestly, I must also confess, unlike Neelakandan, I am not talking about artificial intelligence. I think I have not evolved to the level of artificial intelligence yet. Honestly, people like us have not evolved. But there are certain things we need to do in the hospital, and I am going to quickly run through. Maybe I am notorious for talking little too much in these sessions, but you must allow me because I have come all the way from Chennai to Calicut. Okay, so in technology in hospital's life cycle, what do you do? In technology in the hospital life cycle, when you are planning and designing the hospital, maybe you plan a very nice nurse call system, pneumatic pipeline system, cloud computing, EMS, BMS, AutoCAD. When you are planning a hospital, then I'm going to show you how a nurse call system can reduce the work of the nurses. When it can reduce the work of the nurses will not say, I have 25 patients to attend, I have to go 20 times up and down the corridor, and I need more nurses. So if I can find out a nurse call system that can reduce the work of the nurses, then the nursing staff I can reduce. I'm going to show you now. Similarly, the pneumatic pipeline system. Similarly, if you have cloud computing instead of having servers in the hospital, I don't have to have an expensive IT engineer to maintain the. I have seen it myself. I have maintained an on-premises server. I have also maintained cloud server in the data center. And you talk about building management system, you talk about energy management system, and AutoCAD. Do you know how many of you have used AutoCAD when we are planning the hospital? If I am going to make about 25 changes in my nursing station and in my corridor and in my patient rooms, previously I used to send the drawings and the same drawings will come back in the same state. But today with the AutoCAD, I can change the drawings right then as and when we are discussing. Similarly, the project implementation. Do you know today you can do modular OTs, you can simply construct a hospital. In Kovai Medical Center is organizing one medical college where about 10 lakh square feet of the medical college and the hospital building is going to be done through a modular system. We are simply going to build it and then set it up. Already one hospital has done it in Calicut today. So the time of implementation is reduced almost by about 1 year to 1.5 years. So that is where the technology is evolving in terms of project implementation. And of course, hospital operations, we talk about HIS, EMR, mobile apps, e-procurement platform, inventory management. E-procurement platform, again, a great deal of work has been done. What is e-procurement platform? When we are all working in the hospitals, we have about 40 suppliers, and then all the 40 suppliers are given purchase orders, you raise GRNs, maybe you just have, inventories which are simply A-value items or more than 25%, 30% more. But today, e-procurement platform says that you have one single vendor. You have one single vendor for all the items that you require for the hospital. All the medications will be from one supplier. All the surgical items from the one supplier. It will be online. It will be something like eBay. It will be something like Amazon. Then you know what you are ordering, how much you are ordering, what is your inventory level. You give access to the inventory, your inventory to the supplier. So I think the industry is evolving, and I am going to show you how things are happening today. So very quickly, these are all the major elements of cost, because we are talking about profitability. We know materials consume about 30% of our costs. Manpower accounts to about 22% of our costs. Electricity and fuel constitutes about almost 5%. Medical gases is about 1%, telephone, all that. Totally 69% of the costs are there. You may ask me, sir, when you are called to talk about IT in healthcare, why are you talking about this? Unless you are able to contain these costs using technology, these costs don't mean anything to you. I am going to show it to you how these costs, how electricity costs, if it is, say if you are talking about a turnover of 500 crores in a hospital, 10% is just how much? 5% is a substantial amount. If I can save 10% of that 5 crores or 10 crores in electricity, I am saving a lot. So I think that is what we need to really look at. You must also understand that whenever you reduce any expenditure on electricity, water, materials, manpower, it directly goes into your profit. It directly goes into your profit. You don't have to do maybe 20% or 30% more business to have the same profitability. So I think you have to find out the method of reducing this cost. The only weapon you have is technology today. I want you to understand technology is not expensive. What happened between postcard and email? What happened between ATM and banking system? What happened to your railway booking system and your online ticket booking? What was the cost involved? The cost of technology is becoming a fractional of what that cost was when there is a brick and mortar model. And that too, with this so-called disruptive technologies, things have become so easy and comfortable. Okay. So what are the technologies available now? I'm sure many of you would have heard of all this. But believe me, whatever technologies I have listed here are all used in the hospitals today. You have internet, you have cloud computing, you have RFID, you have pneumatics, you have mobile technology, voice recognition technology, handwriting technology, robotic technology, location tracking, IoT, EOT, IMT. What is IMT? Any idea? Internet of Medical Things. What is EOT? Everything like Internet of Things, everything of IoT. Then 3D technology, microchip, modeling for clinical trials, data analysis, drone technology, genomics, chatbots, machine learning, artificial intelligence. Believe me, through machine learning and through chatbots, I am working on some chatbots. Maybe in the next 2 years or 3 years, all your help desks in the hospitals will go. All your housekeeping help desk will go. All your maintenance maintenance help desk will go. All your call centers will go. Everything will be taken over by these chatbots. The chatbots can answer maybe about 100 of your customers directly, simultaneously. Can you believe? They can talk directly and they can talk simultaneously. So that is going to be the power of this machine learning. That is going to be the power of these chatbots and all that. And do you know what is 3D technology? 3D technology is already existing. In fact, in the last Bangalore meeting, one of the doctors from one of the hospitals from Kerala, he told us how a patient called Krishna, who was suffering with a very, very critical heart problem, they were able to do a 3D modeling of the heart. They were able to do a 3D modeling of the heart. That pediatric cardiologist was able to convince the cardiothoracic surgeon how the surgery has to be done. And he just gave the picture of Krishna before and after surgery. You know that Krishna was taken to Singapore to show as a model case. So please understand, 3D is not in Belgium. 3D is not in Harvard. 3D is here coming into existence in India today. Okay, so similarly IoT. I'm going to show you how it is going to happen. What are the devices? Maybe at that time it was only computer terminal. It was only now laptop. Then the form factor has reduced. Today, I think I must tell you, as I told in the morning, 90% of Jack Ma's single days happened in the mobile. I am going to show you how mobile is being used in healthcare. I am amazed by the way the mobile is being used for patient engagement, for doctors engagement, for hospital administrator engagement, for referring the patients to the doctors, among the doctors, how to monitor marketing staff. All that is happening through this mobile system. Of course, you have laser printer, barcode printers. I don't want to say you have seen all that. But these are all some of the applications we have. You know, I find a lot of young people here. I wanted to make a distinction between technologies, devices, and applications. These are all the applications, and all of them go together to make our patient care easier, simpler, faster, and cost economical. Okay, hospital information system. How to reduce when you are implementing an HIS? Everybody says, no, EMR is expensive. HIS is expensive. I don't have a budget of 2 crores. I don't have a budget of about 80 lakhs. They say this. But do you know, I think Neelkannan only talked about open source during his session. Today, the open source, whether it is on the OS, whether it is on the database, OS for the client, OS for the server, is all on the open source. It is all available free. And the cost of application, cost of HIS software is also coming down. You can get a good HIS for about 3 lakhs. You can get a good HIS for about 10 lakhs depending upon the size of the hospital. So I think all of us, at least the young people, must definitely learn about open source. And open source are more adaptive. They can adapt to mobile technology. Then cloud hosting of HIS. Again, cloud hosting all our applications onto the cloud has got innumerous number of advantages. I cannot list out. I have no time to do that for you. But cloud computing is going to be the order of the day in the next 1 or 2 years' time. Using thin client or all-in-one. Previously, we used to have a tower, we used to have a monitor and all that. It used to be very cumbersome. Today, you have got all-in-one pieces. They reduce the cost of consumption of electricity as well as the cost of the equipment. Outsourcing of computer hardware and network maintenance. Now there is a culture. If I have about 500 computer terminals in the hospital, and if I have a server, if I have a network, I don't hire IT engineers. Because to hire an IT engineer, it is very expensive. He always wants about 80,000, 90,000, 1 lakh. But instead, I just call a company, and then per computer, I give some money, and then I just outsource it. I find my dependence on the software engineers is less. The cost is more economical. So that is one way of doing it. Cloud computing example. I hope it is visible. In one of the hospitals, this was the server, and this was a legacy architecture. We had these 5 hospitals, 4 hospitals connected to one server. Then the server 2, there was one more location. It was connected to another server. And this was another server and the third server, and it was in 3 different locations. Then when the cloud computing came, you found all the locations were connected to one cloud. They call it one instance. So if I have one HIS application loaded onto the cloud, and then if I have a network, MPLS network, I can just implement, believe me, I implemented for about 8 hospitals located in different states, in different metropolitan cities. In a matter of about 8 months, I implemented all the 8 hospitals. And everybody thought, when I used to send a schedule, they thought I was not very serious about it. They thought it was something like running a class schedule. It was not. It was a very serious business I was doing. And you see all that, you have EMR, HIS, SAP, everything hosted onto the cloud, and it was very, very inexpensive. The cloud is available on a SaaS model, that is subscription, software as a subscription. It is available. You don't have to invest on capital costs. So when I talk about open source, as I told you, you have Linux for clients, then you have Node.js for server operating system, you have MySQL for Mongo database, and then you have cost of proprietary software like client server is not there. This is the thin client actually. Maybe somebody wanted to take a snap, okay. This is very, very interesting. This is very, very interesting. I must tell you this. This can reduce your cost by about 30 to 40 lakhs. And this is a very nice, which I use on my, this is the all-in-one PC, very useful. Just imagine, I'm going to show you in one of the hospitals where I implemented, I used about 200 of these PCs working very, very well. The employees are very, very happy. I think I spent a lot of my lifetime in this hospital, wonderful hospital. I think it is not because people like us worked in the hospital, but I want to tell you that Kobe Medical Center is the most cost-effective hospital in this country. Today, if you look at their EBITDA is very, very good. And if you look at the share value of corporate hospital, the share value of Kobe Medical Center is more than that of Apollo Hospital. You may ask me why. That is because the technology adoption in that hospital was fantastic. You go to any place, whether it is, you call it MRI, you call it CT scan, you call it angio, you call it HIS, you call it pneumatic pipeline system. Any technology, I think you must give the credit to the chairman of the hospital. Maybe people like us were fortunate to work in that hospital. There are many of them are here today. But having said that, in a city like Coimbatore, in a tier 2 city, doing this was a great job. Many of them have seen it. Then I said, okay, I think it was possible only in corporate hospitals. It was possible only in large corporate hospitals. But I learned that in medical college hospitals, private medical college hospitals, it was possible. And this is where I worked in the last 3-4 years. And it was a very exciting experience, a very different experience in the sense that you are talking to doctors directly, you are talking to the students, you are talking to the PGs. And I thought it was not possible to implement in a medical college an HIS of this magnitude. But believe me, it was possible. And I think we signed off with this. He's a young man, he's an MBBS graduate, he studied in Ramchandra Medical College. He is Dr. Prashant. We signed up, and before we signed up, it was like this. You see everywhere queues, 200 people standing in the queue. And it used to be very difficult for me to go and see because I was not used to this crowd. And you go to the OP pharmacy, it was like this. Then when you went, you saw everything was in paper. Because I was used to seeing 10,000, in other hospitals where we worked, we are talking about 10,000 computer requests per day. Can you believe 10,000 computer requests per day? It may be 3,000 lab orders, it may be 3,000 medication orders, it may be radiology orders, cardiology orders. You're talking about 10,000. But when I went there, it was about 2,000 orders written in hand. But I said, this cannot happen. Then what happened? This is how, all these forms used to be in the rack. This used to be in the rack, I cannot see this. Then, there is an old man, he used to do ICD coding. He is doing ICD coding. But these are all the modules. Maybe I'm going to leave the presentation. You can have the presentation there. All these modules were implemented. In fact, this is a very nice backbone software which we implemented there. And of course, you must also, there are a lot of other softwares like idea objects. Some of the softwares are good in workflow. Some of the softwares are good in EMR. This is one of the softwares that are very good in EMR. And what I want to tell you, this is one point I think all of you must note. Here you see here, this is an EMR screen. In the EMR screen, you have the diastolic pressure, systolic, all vitals. I think I must address what Neelakandan said. In ICU, we have people like us work in hospitals where we have 100 ICU beds, 200 ICU beds and all that. And ICU nurses are very difficult to get. Their work is very, very tedious. So when they were trying to take these readings, they have to take the reading, unlike in the wards, they have to take once in 4 hours. But here they have to take once in 15 minutes, once in 30 minutes. They have a huge chart before them, and God only knows whether they write it correctly, whether they write it at all, what doctors are doing, we don't know. But the point is, you cannot blame them also. Then we have to find a solution how to get that values right, because it's life and death issue for the patient and the doctor, right? So now came the charting solution. Where the Philips monitors, ventilators, Maca ventilators all got integrated, and we got what is known as charting solution. But we used to get about, say, 10 monitors for about, say, 25 lakhs. When I asked what is the charting solution to reduce the work for the nurses, that guy says 2 crores. Charting solution is 2 crores. No doubt it's a great deal, but it is not acceptable to me. Then now comes the technology. Now comes this artificial intelligence. Now comes cloud computing. Now comes IoT. Now technology in the last 1 year, believe me, sir, last 1 year you have got an IoT solution. Bangalore guys are doing, and they are all people come from GE and Siemens. They have already done the prototype in Narayana Hrudayalaya. They have done it in Max Hospital, Delhi Hospital, HCG. It's a small IoT device. They have devised a program. And this IoT device is plugged on back to the monitors, and all these critical values get captured every 10 minutes, goes to the cloud and comes to the EMR. Simple. So that is what is that's what happened. We are trying to do this in this hospital, and you see this is the first one important thing when you are talking about implementing HIS is doctor staff engagement is very, very important. I think we spent a lot of time engaging the doctors, engaging the staff. So you must understand, in a medical college hospital there are about 2,000 employees. So we went on talking, and then this is the kind of meetings we had. And you had very good doctors like him, a neurosurgeon who trained the doctors. Training the doctors is not so easy. And we used to talk like this and then do training sessions like this. Hands-on training, they had a huge computer lab and we trained them. And you are talking about computer vision entry. And finally today, this is a report I have as of yesterday, they make about 2,500 requests every day. All these 2,500 requests for 15 long years were made in hand. That is a medical college hospital existing for 15 years. Today I find people are very happy, and you find they use, can you see this? This guy is using a barcode scanner. A fellow who did not use computer is using barcode scanner. And this fellow is using all-in-one desktop. All-in-one desktop he is using. And you see that, and the rack is empty. All the rack has gone empty, and you see Dr. He is the neurosurgeon who he stood before it was empty when it was full and all that. And this is one interesting thing. If you have seen in Manipal Hospital, now the registration, you can go to the kiosk, do pre-registration, and then go to the registration counter and get that registration done. So all these things are being done in this. Finally, at the end of the day, you are very happy you implemented a good HIS solution, okay? So this is a voice recognition. How many of you have used voice recognition solution? You are using. Good. And I think it's again a very interesting and exciting application where you simply dictate And maybe in large hospital like KIMS or maybe Aster or Apollo or Covey, they have about 200 to 300 reports. We don't depend on secretaries. We just dictate, and it is a super software which they are using. And you see the doctor, this is the Dragon software, and there are compartments like this, and they do it. How many are using handwriting recognition? Anybody using handwriting recognition? People like us use that. Very interesting. Please try. This was demonstrated in Medical, and this is a device. You just simply write on paper, it gets transferred to the EMR. And it is becoming very, very popular nowadays. Virtual operation theaters, again very interesting, and now it is little expensive. This was one which I took in Düsseldorf in Germany. I went to the theater and I found there were only 3 people in the operation theater. Only 3 people. The surgeon and 2 assistant surgeons. And what he is doing, he is just programming everything. You know, sir, your data, your artificial intelligence is here. You know, if Dr. Neelakannan is there, Dr. Neelakannan is a surgical oncologist. He does pediatric cases, he gets adult cases, he does male, he does female, he does obese, he does lean cases, every case he does. And he does different types of cases. So this computer software, it notes down everything and it adjusts the settings. His height of the table, the light fittings, the light luminance. Then maybe you have a laparoscopic equipment, all these laparoscopic settings. Maybe there are about 200 settings which have to be done before you start a surgery. Whether it is room temperature or humidity or whatever, everything is done through this system. So practically there were no nurses in the hospital. There were no nurses at all. And you see, this is where the clinic, these IoT devices get connected to these monitors, and it goes to these charting solutions. And this is, see, in fact, I have listed out a lot of advantages of these clinical initiatives because of the IoT. I am leaving it, maybe you can see this later. You see a time clock here. What does it mean? Anybody can make a guess? What does this mean? Anybody can tell me what is this? This clock is very important in a hospital. Why? Do you know what is known as a GPS clock? What is the purpose of GPS clock? GPS clock gives you a universal time, same time all over the hospital. And this GPS clock is important in the operation theaters, delivery rooms and things like that. Maybe a baby that is born as 12.1, 12.01 is next day, right? Maybe 11:59 is the previous day. So I think all clocks should show the same time. This is connected to the GPS, and this is a device that has come, and now hospitals are using this. And nurse call system, I told you, this is a very interesting nurse call system. And there are 2 types of nurse call systems. And in a long corridor like this, if a nurse has to come, and this is the nurse call system, and here in the conventional system, you just press, the nurse has to come. But she has to walk the long corridor, then find out what is the problem. Then that guy will say, I just want a hot water, tumbler of hot water. Then she has to go back and get it. Just imagine she has to walk so many times in a night shift or a day shift. But now these kinds of handsets have come. This is the voice-enabled handset. So the patient can simply say, I want hot water, or I want a blanket, or the IV solution is getting exhausted. Please come with an IV solution. Coming with an IV solution is a nursing activity. Coming with a blanket is not a nursing activity. So this particular vendor has changed the workflow so much. Can you believe, you know what he has done? He has done in this monitor, you can even program the housekeeping tasks. So you simply have to program the tasks, and then you simply press a button, it will go to the housekeeping. Press a button, it will go to the maintenance department. So you don't have to call, you don't have to raise a ticket. So it becomes so easy. Maybe a distributed antenna system is one thing which now it is becoming very popular, because we have different vendors like Idea, we have got maybe Airtel, we have Jio. Now everybody puts an antenna and it becomes cumbersome in the hospital. So when we want 3G and 4G connectivity and Wi-Fi connectivity, it is difficult to have multiple boosters. So now the system has come with a distributed antenna system. Then these are all some of the mobile applications I am sure most of you would have seen, but still I want you to see. You see, this is the kind of mobile app you have. And you see, for patient engagement, this is how it looks. You can engage the patient through your mobile app. You can give details about the hospital. You can register a patient. The beauty in this is when a patient gets admitted in the hospital, using this mobile app, he can order for food, he can order for maintenance ticket, he can order for food services. He can order for, even see the billing. So you can see what is the bill he has, what is the amount he has paid, what is outstanding, all that stuff he can see in the mobile itself. He can raise a ticket, he can say door is not working, cot not working, he can do this. Then then this is the doctor's app. Doctor can know how many he has seen, how many are waiting in his office. Then he has got the entire medical record in this mobile app. Hospital administrator app, maybe people like you can see how many outpatients have come, how many inpatients have come, everything can be done through this app. Please understand it's all live connected to our HIS, connected live to the HIS. I don't have to go to the workstation or my laptop. You can see the trends. And this is a very interesting thing, like Dr. Ghani said, this is a project I want to give you. Maybe you have about 600 to 700 patients who come to the hospital each day. And you tell them that revisit not required, review required, procedure required, surgery required. But you have to follow up for them to get converted into review, to procedure, to surgery, to that. But it is a huge Herculean task, you know. We used to give it to the call center people, and call center people will do it for about 8-9 hospitals together for our group hospitals. But we are going to employ chatbots for this, so that there will be a perfect data of what has happened. And this is a new, how many of you have used this referral doctor app? Now a new app has come. Have you seen that? It's a easy refer, it's a beautiful app. And if you want to refer one patient to another doctor, you know, another doctor can use this and we can refer, so everything is documented. And you can register this, this is how it comes. And this is again, sir, this tele-evidence, I think I'm trying to introduce it in Tamil Nadu and if possible in Kerala. When I went to Chandigarh, I found the PGI Chandigarh had developed this tele-evidence. So what they have done is they have connected themselves to the court, connected to the judiciary, and the magistrate can take the evidence of the doctors from inside the hospital. Okay, and you see the doctor, a medical doctor giving evidence, and there you find that magistrate sitting. And this is PGI Chandigarh. They have got about 3 or 4 rooms, and they do, I understand, they do medical evidence. They give about almost 40 to 50 medical evidence per week, and they have saved about 20 crores of rupees for the. And the only thing is the Punjab judiciary has been very good in accepting telemedicine, tele-evidence as an evidence, this thing. So I have applied, and I am now going and meeting the Chief Justice and the Solicitor General to find out whether the Tamil Nadu government and the Tamil Nadu judiciary can accept this tele-evidence, as citing Punjab as an example. This is portrait tracking is again very interesting. I told you you must give me another 5 minutes. I think your lunch, I am delaying you a bit lunch. This is that portrait tracking. You can track the porters using this. Just have to send the request through the porter. They are using barcodes. And now there is a new technology using RFID. And once you enter the detail, Manipal Hospital is using this, and this goes into the RFID tag of the patient, of the porter. So it is something like Uber. You know, it is something like Uber. Uber driver gets an intimation and he comes to your house. Like this, he can go to the different places in the hospital and he can transport the patient. And we can find out if there are about 17 floors in the hospital. We can find out if there are 20 porters. We can find out the location of the porter, each porter. So that we are able to track, we are able to log how many transports each patient has done. And this is the log we have using this RFID tag, very, very effective. They have introduced it in Manipal, Bangalore. They have introduced it in Manipal, Dwarka. And of course, tracking of ambulances, you know what we are doing. This is medical. This is again a very interesting technology. Medical education technology is very interesting. I saw a lab museum there, Vaidegi Institute of Medical Sciences, and you must see this is a museum where you have some gestures. Using these gestures, it will show you anatomy and physiology of this. People who have time should definitely visit this museum in Bangalore. And this is the museum, and this is again all the anatomy and physiology they teach using this. This was the procurement platform I was talking about. You can simply connect to this vendor and he will buy everything for you. These are all the things which you can buy. You can buy all these major components through particular vendor, and it is all through the electronic network, and all these GST problems and all is solved. So he will settle the GST, and you are able to get a better price because he is aggregating through many of the nursing homes and small hospitals, And it is done in the manufacturing, but now it has come to healthcare. It is a very, very interesting concept. And small hospitals who cannot get the same, see, you are talking about MRP. Why maybe Apollo or CARE or KIMS or KMCH is able to get IV cannula much lower price? Because of the volume. Same thing they are trying to do for all the nursing homes together. So that's a very interesting concept that is evolving. This is the digital payment system, closed loop digital payment system. I think I have spoken before, but this is also very interesting. This is an NFC card. Using the NFC card, patients can use, maybe employees also can use. You can get it on the mobile, how much they have used in the hospital. And of course, this pneumatic pipeline system, all of you know, but there is one thing which I want to show you and close. This is the building management system for large hospitals and building management system for small hospitals. And this is a small hospital solution one guy has developed. You just have to invest 1,50,000 rupees, and you can reduce the electricity charges, you can manage your air conditioning system, you can manage your diesel levels, all that you can do. And you can manage, because of low power factor, misuse of water, pilferage of gas from the gas cylinders. And this is what he has got. He is using a technology called LoRa, and then he is implementing and he is giving you the solution. And in fact, he has done it for McDonald's, he has done it for S-Banks, and he is able to get all the details on the cloud. This is again a very interesting thing, and you find this is an energy efficient fan which has been developed. It's about 50% more energy efficient than the regular fans. And just imagine if you have about 500 fans in the hospital, you save about 5 to 6 lakhs per month on electricity alone, 5 to 6 lakhs per month. So, of course, I have given some readings, and this also mobile app, you can manage the energy and through the mobile app. And this is what we developed in one of the hospitals. If you have seen in Continental Hospital, this was developed. You can see Honeywell building management system. But the last one I wanted to show you was this. This is a e-facility. All of you, if you have time, this is the sir, I saw. He was talking about lean green. You said in the last slide, lean green hospital. And to make the hospitals green, what we should do. So this is a LEED certified, platinum certified building, and we are going to use their services. And you will see solar panels on the glass facade. And this is most interesting. What that guy has done is he has got a dashboard in his entrance, and he is talking about water consumption, he is talking about electricity consumption, he is talking about air quality, everything on the dashboard. That is, it is in Coimbatore, e-facility guy has done. I visited this facility, and everything is managed to the touch screen. You know, you can program, you can program everything here. You can program everything in the room, and the solar panels he has got, and this is the dashboard. And you will see here, he has got a dashboard for everything, water quality, or maybe energy metering, maybe tank, water tank details, everything is available. Even kitchen and dining halls, he has got NFC system where you have to, as you enter, you have to say that I have come, and the kitchen will start preparing food for you. They won't prepare food before that. And last, I think, this is something to do with technology and Swachh Bharat. It is something to do with technology and Swachh Bharat. This is a slide. This is a slide I got when I went to Boston. You see how the waste is disposed in Boston. And of course, before that, there is one parking management system, the MPLS. It is there. You can park about 400 cars using this MPLS system, and this also through technology. But what is happening here in India today, you go to Chennai, you go to any place, it is like this. But when you go to America, you see the houses like this. Then you see the lady putting it like this. But what is interesting technology is that this is the CCTV. So I only wish that if we can have CCTV in all the places, and you can monitor everything, and we will know who has done the damage and what should be done. So of course we even transplant trees, and so knowing is not enough, we must apply. Willing is not enough, we must do. Thank you very much, and I think I took longer time, but
I request Mrs. Vijay Varghese to hand over a memento to Mr. Ananthapadmanabhan, because it is an interesting thing also. She is a student to sir.
Yeah. Wow. What is very, very interesting, and I am very proud about it, is that was my intern for about 1 month from Tata Institute. You know, Tata Institute is one of the premier institutes. And today she is the CEO of a huge Rajgiri hospital, and more than her, I am proud that my student is now heading this all the way. And it is a privilege to get a memento from her.
Thank you, sir.
You have to give a pose also. 1 minute, please. All beautiful people have to stay.
I think thanks for putting.
But everybody is angry also. That also you have to take into consideration.